Okay, so to begin, I'm just going to check the order. It's for my patient Alex Sim. He has no allergies. His date of birth is March 2nd, 1964. He is experiencing nausea and vomiting, so I'm going to be giving him diamond hydronate or Gravol. It's available in 100 milligrams per 1 milliliter. His dose is 50 milligrams, so I'm going to have to do a med calculation. It's given every 4 hours as needed, and he hasn't had it yet, so that's okay. And it's given intramuscularly. So I'm just going to do my med calculation. So I need 50 milligrams per dose. And available we have per 1 milliliter is 100 milligrams. So that's going to give me 50 milliliters per 100 doses. And when that's reduced, I'm going to get 0.5 milliliters per dose. Okay, and I'm going to get this medication. And I'm just going to do my first check. So diamond hydronate, 100 milligrams per 1 milliliter. It expires December 25th, 2020. Diamond hydronate, 100 milligrams per 1 milliliter. So now I'm just going to perform hand hygiene. And I'm going to gather my supplies. So I will be using a blunt tip needle to fill my syringe, a 1 milliliter syringe, because I'm injecting less than a milliliter of medication. And I'm going to be using a 22 gauge 1.5 inch needle because I'm giving an IM injection. So then I'm just going to do my second check before I start filling up my needle. So diamond hydronate, 100 milligrams per 1 milliliter. Diamond hydronate, 100 milligrams per 1 milliliter. Okay, so I'm just going to pop this lid off. If it was already off, I would cleanse the top of this with an alcohol swab. And I'm going to get my syringe out. And I'm going to leave my needle in the package. Then I'm going to get my blunt tip. I'm going to attach them. And so I'm going to be injecting 0.5 milliliters. So I'm going to suck air into 0.5. I'm going to remove my needle lid. And I'm going to inject the air into my medication. I'm going to flip it upside down. Then I'm going to flip this back around. I'm going to recap my needle. I'm going to get all the air bubbles out. I'm going to push all this air out. So now I have 0.5 milliliters of solution in there. I'm going to label my syringe. So it is diamond hydronate, 100 milligrams per milliliter. And I'm just going to attach this to my syringe. And then I'm going to get this needle tip ready. I'm going to take off my blunt tip needle. I'm going to go straight to my other needle. I'm going to set that down. My blunt tip needle is going to go into my sharps container. And then I'm going to do another med check. So diamond hydronate 100 milligrams per milliliter, diamond hydronate 100 milligrams per 1 milliliter. Okay, and then I'm ready to go into my patient's room. So I'm going to be injecting into the ventrogluteal. I'm going to make sure that I can feel the iliac crest and the iliac spine with my fingers, and I can feel the head of the femur with my palm. Okay, so I'm just going to enter the patient's room. Hi, Mr. Sim. My name is Maddie Monday. I'm a nursing student from Lambton College in my second year. I'm just here to give you an injection. Is that okay? So I'm going to perform hand hygiene. I'm going to close the curtain for privacy. And Mr. Sim, can you just state your first and last name and your date of birth for me? Okay, and do you have any allergies? Okay, perfect. So I'm just going to perform my fourth check at the bedside. So my syringe is full of diamond hydronate 100 milligrams per 1 milliliter. And my order says diamond hydronate 100 milligrams per 1 milliliter. So that's perfect. So Mr. Sim, we're just going to be giving you an IM injection today. It's full of diamond hydronate or Gravol. It'll help relieve your nausea and vomiting. Is that okay? Okay. So then I'm going to bring the table or the bed up to a working height. I'm going to landmark on Mr. Sim. Make sure that I can feel his iliac crest and his iliac spine, and also the head of his femur. And the max that you can inject into this area is 2 to 3 milliliters. Okay, so I'm just going to perform hand hygiene again. I'm going to put my gloves on. I'm going to clean the area with an alcohol swab and a spiral motion, working from the inside out. I'm just going to let that dry. The skin looks like it is dry and intact. The muscle size is average for a man this size. So then I'm just going to open up my needle. With my non-dominant hand, I'm going to landmark and use the Z-track method. And I'm going to dart my needle in at 90 degrees. I'm going to pull back on my syringe and make sure that I don't see a flash of blood, so that I know that I'm not in a vein or an artery. I'm going to slowly inject my medication. I'm going to leave the needle in there for another 10 seconds. Okay. I'm going to take my needle out. I'm going to flip the needle safety lock on. I'm going to dispose of that in my sharps container. I'm going to dab the injection site with some gauze. Make sure that Mr. Sim is feeling okay. I'm going to stay with him for a little bit just to make sure that there's no allergic reaction to the medication. If Mr. Sim was still bleeding, I could tape some gauze on there. And then I will just document my findings, or document my injection on the MAR. Okay, so for my documentation, I'm just going to put the time, and I injected it at 12:30, just after lunch, when he was feeling nauseated. I'm going to put my initials, and then I injected it into the left ventrogluteus IM, so I'm just going to put an O here and a circle around it. To evaluate how effective the medication was, I would go in and see Mr. Sim during the onset and the peak of the medication that I injected, and I would see if he was feeling any better, and I would assess any redness or swelling at the injection site. Some safety issues could be there could have been a needle poke injury, or he could have had an allergic reaction.